Well, I want to welcome everyone back to Infectious Insights. I'm Dr. Tina Tan. I'm a pediatric infectious disease specialist at Ann and Robert H. Lurie Children's Hospital of Chicago. I'm a professor of pediatrics at Northwestern University's Feinsberg School of Medicine, editor-in-chief of Contemporary Pediatrics, and president of the Infectious Diseases Society of America. And in this episode, I am joined by Dr. Candice Jones, who's a board-certified general pediatrician in group practice in Orlando, Florida. She's a former National Health Service Corporation scholar and a spokesperson for the American Academy of Pediatrics. She also is an author and a major advocate for child health. And today we're going to be diving into the challenges around the back to school vaccinations and what recent ACIP changes mean for pediatricians on the front line. So Candice, thank you so much for joining me. This is going to be great.
Yes, I'm looking forward to the discussion. And thank you so much, Tina. Always good to talk to you.
So you want to launch this?
Sure, I can jump right in. So there's been a lot going on, right?
Yes.
With the Advisory Committee on Immunization Practices. We have a new committee, and I am worried. I'm frustrated, as many of us pediatric providers are, I'm sure. That's my initial, and I don't know what's coming and what to do. There's a total level of uncertainty as how my practice, how the care of my patients can be impacted by these potential changes, by the things that are being recommended or not recommended. And so how are you feeling about that? What are you hearing?
So basically, that was a very radical thing that was done when that Secretary Kennedy basically dismissed the entire ACIP um, committee. And basically, the 17 people that he dismissed were very highly vetted scientific experts on vaccines. And they were in multiple different fields of medicine, basically to cover the use of vaccines in persons of all ages. And the people that he replaced them with are known to be anti-vaccine, anti-science, and basically they want to do away with the childhood immunization schedule. So yes, it is very worrisome. And when the last ACIP meeting was held, the AAP and other organizations did the most appropriate thing when they refused to basically participate because they did not want to seem like they were supporting whatever this crazy committee was coming out with. So it is a concern because it does have the potential to severely impact infants, children, and all other individuals that receive vaccines. So the recommendations that AAP, IDSA, ACP, AAFP are putting out right now is to use the recommendations and the schedule from vaccine schedule from 2024. And basically AAP, ACIP, IDSA, they all have the 2024 vaccine schedule and recommendations on their websites. And that's what we should be doing. So right now, nobody should be listening to anything that this current ACIP or Secretary Kennedy is putting out there with regard to recommendations because they are going to severely harm all the patients that we care for.
Yes, I totally agree. And I thank you for that recommendation as a general ambulatory setting pediatrician, because we look to this committee, the prior committee,
Mhm.
as you mentioned, we look to the CDC, we look to the AAP and other credible organizations to guide us in these, updates that come out with schedules. And so when we don't have that, that's why we have the feelings that I mentioned. And so I hope everybody got from you. Follow the current 2024 schedule. Um, and the AAP has made a commitment and others what I understand is that they put out a childhood immunization schedule, even before the ACIP existed. And so we can trust that they will continue to do that, and we can follow that evidence-based guidance. And
Absolutely.
yeah,
And also, a number of organizations, including AAP, IDSA, ACP, AAFP, ACOG, American Public Health Association, we all working with the Vaccine Integrity Project to put out scientifically sound recommendations for the use of vaccines. Um, and the first recommendations that will come out will have to do with the respiratory infections that, and the season that is now approaching. So you
yeah.
will, but probably by the end of the summer, get recommendations for, flu vaccine, RSV vaccine, um, COVID vaccine, and other vaccines that protect against respiratory infections.
Yeah, that is a great segue because those are the things as we get into back to school, right?
Mhm.
That's important. The COVID, flu,
Mhm.
RSV, those are the seasons. We know kids are coming off their different other viruses, enteroviruses, things of that nature, other respiratory and GI infections. When school starts back, there's always some strep throat,
Mhm.
secondary bacterial staph or strep ear infections with colds and stuff. And so these are the things that pediatricians need to be ready for, an uptick in that when kids get back to school, but making sure that kids are up to date on their
Absolutely.
vaccines, getting the vaccines that are recommended for their age according to the 2024 schedule, I think is so important in the midst of all of this madness, us staying the course, um, and continuing public health strategies and
Mhm.
strengthening our administration of vaccines.
Absolutely. And I mean, the other thing that I know you all are facing, because I face it, is the increase in vaccine hesitancy.
Yes.
And so all of us need to, I know it takes time, but we need to take the time basically to speak to the parents, find out what their concerns are, and help address them. Because with all the misinformation and disinformation that is circulating on social media, and is out in the world right now, parents are getting very, very confused as to should they get their child vaccinated because they don't know what information to believe. And so I think we as pediatricians really need to provide them with sound scientific information to help them decide, to vaccinate their kids.
Yes, as a pediatrician, that is something I'm seeing. I'm at a federally qualified health center in Orlando,
Mhm.
and we have mostly Medicaid patients, lots of uninsured patients, lots of patients coming, um, immigrating in from the Caribbean, from Central South America, all over, multiple languages. And so I would say our patient population is very sensitive to pseudoscience, right?
Mhm.
To misinformation, to myths, and all of these things. And so I honestly, one day I was so frustrated. I said, I don't know what I'm going to do. um, because every day I'm practicing now, every day I see patients, I'm having a family that has other kids. Parents are vaccinated, older kids are vaccinated, but now they have a new baby or a younger baby, they're no longer vaccinating, right?
Right. Hmm.
And and it's just so frustrating because what changed your mind? What, and it's like an epiphany to them of some type. And so, like you said, I try to engage the why. What helped you to come to this decision? Can we discuss it and try to dis overcome that misinformation, give them the correct, credible sites to look at if you want to know what's in the vaccines, if you want to know why that is in there and what it's for, and the common questions. So I heavily offer up the vaccine education center at CHOP
Hmm.
because it breaks all that stuff down, and I'll
Right.
open it up and we go through it, and this is why, and this is not toxic, and that's misinformation. And so I think it's so important for us to take the time to do that. And I will say that overwhelmingly, most parents still vaccinate their children, but we are seeing that uptick of more and more hesitancy and refusal. And the reason, and we know that's true because we have a measles outbreak.
Right.
Yeah,
Exactly. And a pertussis outbreak.
that's right.
And it's just that, you know, um, I've heard from a number of providers here that say the exact same thing as you, that they've had patients whose parents, had been bringing all their kids to them for years, and then they have a new baby and they don't want to vaccinate them. And when they try and find out why they're doing it, um, they basically are told that they hear all this stuff um, on, the media, on social media, from other people in the community, and they're not sure what to believe.
Yeah. And it raises fear. And I think
Mhm.
that's what's so frustrating about this current administration, because they are purposefully stoking fear to
Absolutely.
erode that public distrust in immunizations. And
Mhm.
so every parent loves their children. And so if I can potentially do something to harm my child, okay, I'm not going to do that. And so we have to find ways to overcome that
Mhm.
and have some countermeasures to that.
Absolutely. Absolutely. With the potential cuts in Medicaid and the VFC program, and, the question of whether or not multi-dose influenza vials will be available, access to vaccination for some people could be a major issue.
Yes, yes. And that is so concerning. Um, I was just reading, even pharmacists are, as we know, Obamacare, the Medicaids mandate
Mm-hmm.
coverage of these vaccines if it
Hmm.
is recommended, right? By
Right.
the ACIP, by the CDC, and all that. So when they cut their recommendation, then we're in trouble. And so maybe the pharmacies won't carry it, maybe the insurance won't cover it. I know with our FQHC, if it's something not recommended, then the VFC program may not carry it for us to order it.
No, I
So
know.
then patients can't, we don't even have it to give for
Right.
free or covered. And so this could be devastating.
It absolutely could be. And I can just tell you that when the threats of all these cuts were coming around, a number of us in these organizations, we spoke to the insurers and let them know, that if they decided not to cover vaccines, they would have to be spending a lot more because people would be hospitalized, they would need all these other procedures. They could die. So, from what I'm hearing, the vast majority of the large insurers are going to continue to cover vaccines.
Kudos to that advocacy, because that's what it's going to take. We're going to have to, take large groups like the AAP and individuals like you, infectious disease specialists, giving the facts where we can and advocating and working around the madness. So
Right.
thank you so much for that.
No, thank you for everything that you do for your patients because I know now it becomes more and more difficult.
It really is. It's really frustrating. I know it adds to physician burnout too. All of this
Mhm.
distrust. It's not just vaccines, it's anything, medicine,
Right.
procedures, women getting mammograms. All the distrust is harming every public health, preventative health
Hmm.
measure in the world of medicine. And so we are really going through it.
We are. We definitely are.
Yeah, yeah. But we know why we're here. And so we have to hold to that and find strength, like you said, in the numbers with each other, having these conversations and encouraging one another that we're doing the right thing, and speaking truth to the misinformation
Right.
every chance we get. I really appreciate the AAP's fact check site that they put out.
Hmm.
That they're and all of these doctors that are getting on social media. I want to do it so bad, but I don't have the time. I'm like, how do they find the time to do this? Because you really have to research this foolishness we're hearing and then break it down and then come up with this video to say why it's crazy, right? But
Yeah.
there are some docs that are doing it, and I so appreciate them. And I share all their information. Like, I don't have to do it. I'll just share
There
yours.
you go.
So one thing I wanted to ask you as a general pediatrician in outpatient setting is there are some new vaccines on the horizon,
Yeah.
additional options for RSV, for meningitis coverage. Can you share something about a little bit about those?
So the new monoclonal antibody for coverage of RSV is great in that it gives you additional supply to protect your infants. And it's going to work the same way that Nursivimab is given, in that it'll be given to all babies, or it can be given to all babies under 8 months of age. Now, one thing about this monoclonal antibody is that we don't yet have data on what the duration of protection is. Like with Nursivimab, we know what the duration of protection is. With this particular monoclonal antibody, the data is not yet available as to duration of protection. And then with the um, meningococcal vaccine, I guess the question becomes, what are you going to cover and contain in your offices, right? Because, I mean, for most practices, people have to upfront buy the vaccine and then, basically get reimbursed through um, the insurers. And I think the insurance company should cover it, but that's something that you're going to have to wait for to see. But I think that vaccine also gives you additional choices as to the vaccines you can use.
Yes, I totally agree. I have not had the drug reps to come around on these two yet. I know from all of the wonderful information I get from the AAP that these are on the way.
Mhm.
And at our FQHC, me being the primary pediatrician, we hear the information, we get the information, we decide, do you want to use this one? We don't keep all of them, right?
Right.
It's just like you said, not feasible. And we decide which one will work best for us that kind of goes into the existing schedule for the patients
Mhm.
and stick with one and go with that,
Right.
or whichever one we feel is better. But it's always good to have options, especially if there are ever supply issues,
Right.
like you said.
Absolutely. Any other things that we should discuss?
No, I think this has been very helpful. We covered a lot of information. And what I got from it is, initially I was very worried, but you have taught me as a primary care pediatrician that I have somewhere to go and stick with for my guidance currently,
Mhm.
and that there are very bright people working in the background to help us overcome this. And I'm going to stay the course.
Absolutely. That's wonderful. And it was an absolute pleasure talking with you.
Same as always.